Medical practices invest heavily in modern electronic health records and advanced clinical tools. Yet the moment a patient walks through the door, the experience often remains stuck in 1995. The visit begins with a clipboard and paper forms. That stack of paper creates an immediate delay. Industry data shows the average patient spends 15 to 20 minutes sitting in the waiting room just filling out paperwork before they can be seen. The burden then shifts to the staff. Your front desk team spends 8 to 12 minutes per patient manually deciphering handwriting and typing that data into your EHR system. This bar chart visualizes a standard 8-hour clinical workday. If a practice sees 30 patients a day, manual transcription consumes a massive block of 3 to 6 hours. That is highly paid staff time devoted entirely to data entry. The clipboard is a structural bottleneck. It guarantees your schedule is running behind before the first physical exam of the day even begins. Rushed front desk transcription creates a cascading series of critical data errors. When staff are trying to clear a crowded waiting room, typos and omissions are inevitable. Patients change jobs, employers update benefits, and government programs adjust eligibility. Because of this constant churn, 25 to 30% of patients arrive at the desk with missing or outdated insurance information. This area chart breaks down the most frequent causes of insurance claim denials. Looking closely, 46% of revenue cycle leaders identify missing or inaccurate patient data as their top issue. The financial penalty for these front desk errors is steep. Reprocessing a single denied claim costs a practice an average of $118. A fee that multiplies across hundreds of claims each quarter. Because insurance verification is skipped during the morning rush, these eligibility issues do not reach the billing department until 3 weeks later, long after the patient has left the office. A minor manual transcription error at 9 in the morning translates into a systemic revenue cycle leak by the end of the month. The stress of managing a chaotic check-in desk falls entirely on your employees. Front office staff are consistently the highest turnover roles in outpatient practices today. Losing that institutional knowledge is very expensive. Factoring in recruitment, onboarding, and lost productivity, replacing a single front desk role costs the practice between $9,000 and $12,000. Practices find themselves trapped in a loop. They spend 6 to 8 weeks training a new hire on specific EHR workflows, then achieve a brief period of stability, and then the employee leaves for a less stressful job in retail or customer service. You cannot build an efficient revenue cycle on top of a continuously rotating, under-trained front desk staff. High-performing practices are fixing this by changing the location and timing of the work. They shift the entire check-in process away from the waiting room, executing it 24 to 48 hours before the appointment. They achieve this by outsourcing data collection to a dedicated remote team. Rather than a rotating pool of generalists, these trained professionals learn your specific clinical requirements and handle patient outreach entirely off-site. Using a combination of digital text links and smartphone outreach, these teams routinely get 75 to 85% of patients fully registered before they ever leave their house. Pacing quickens slightly. While the team handles the outreach, an automated AI later cross-references the collected patient insurance information against payer databases in real time, instantly catching coverage lapses before they result in a denial. By the time the patient arrives, the rooming nurse already has a complete, verified pre-visit summary, including verified demographics, updated allergy lists, and current medications, loaded directly into the EHR. Moving the check-in process pre-arrival eliminates the waiting room bottleneck entirely, saving clinical staff 5 to 10 minutes per appointments at the point of care. This bar chart compares the direct expenses of the two approaches. Hiring an in-house check-in coordinator costs a practice between $50,000 and $75,000 a year, fully loaded. Alongside it is the much lower cost of a dedicated specialist from Staffingly. The remote specialist operates at a fraction of the hourly rate. By utilizing an external team, local overhead, payroll taxes, and benefits costs dissolve completely. For a growing practice, replacing 3 to 5 full-time equivalent positions with this model translates directly into $100,000 to $200,000 in annual savings. The transition is fast. Using an API connection to your existing EHR system, practices are typically fully operational within 48 to 72 hours. Modernizing the check-in workflow acts as a direct recovery of lost revenue and wasted overhead. Delegating patient data collection requires absolute trust. Companies executing this at a high level maintain enterprise-level security to protect sensitive patient information. All patient check-in forms are encrypted end-to-end, and the operational infrastructure strictly adheres to HIPAA, SOC 2 Type 2, ISO 27001, and HITrust certification standards. Transitioning your practice to a remote team requires no long-term humtracks and begins with a 30-day free trial. The cost of abandoning the clipboard is lower than you might think. The financial cost of keeping it is simply too high to ignore. Visit staffingly.com/demo or call 1-800-489-5877 to reclaim your waiting room today.